Okay, so one final time before we get started, I just wanted to again say hey to everyone. Thank you for joining us tonight. We're really pleased with the turnout and everyone's interest in listening to the science, as we of course all should. We're now at just over 250 participants, which is amazing. We'll just give it 2 more minutes. And while we're waiting, I'd again like to ask you to do the same 3 things. So first, make sure you signed our petition to pause the reopening and take fall 2020 online as much as possible. The petition link is in the chat. And then 2, please share this petition on social media with the hashtags Listen to Science and Save September. And you'll see those on the slide in front of you. If you've shared it before, again, please share it again. And then finally 3, please tweet at U of T to Listen to Science, pause the reopening, and make fall 2020 TA and other work remote wherever possible. And then finally, one logistical thing. If you would like to ask questions of the panelists, ask questions generally, or suggest questions for us to ask U of T, please enter your questions in the Q&A field at the bottom of your screen. There are a few other fields at the bottom of your screen, but we're only going to be using the Q&A field tonight. Okay, so it's 5:10 now, so I will get us started. My name is Amy Conwell, and I'm the chair of CUPE Local 3902, which is the union representing contract academic workers at the U of T, including teaching assistants or TAs, sessional lecturers, and postdoctoral fellows. I'm also a doctoral candidate at the Center for Medieval Studies and a teaching assistant and course instructor in the Department of English. CUPE 3902 has been working with a campus coalition comprised of the U of T Faculty Association and 4 other U of T staff unions, USW 1998, CUPE 3261, CUPE 1230, and CUPE 3907, to call on the university to take an inclusive, consultative, science-based, and equity-informed approach to the campus's reopening. That is, a safe approach. Our coalition represents over 20,000 faculty and librarians, contract academic workers, library workers, service workers, graduate assistants, and administrative and technical staff at the university. We know that in this global pandemic, it is more important than ever to come together to find collective responses to collective problems. And so we would just want to thank you again for joining us tonight to listen to the science on the reopening of U of T and think together about what a safe September would look like for us all. We all share both a community of interest in a safe campus and a safe city, and a community of risk, in that the risk to any one of us will increase the risk that all of us face. So we've been working together all summer to call on the U of T to put safety first. With this in mind, and after much fruitless back and forth with the university, together we launched a petition in late July to call on the U of T to pause the reopening and take fall 2020 online wherever possible. The ask of the petition is simple, and it's similarly supported by a few simple concerns with the U of T's approach to the reopening and the science. First, the U of T has not involved workers and students in decision-making about the shutdown or the reopening. Our coalition groups have been informed of decisions made that impact the working conditions of all of us, but we've been informed after the fact. And many of the questions that we've then raised in response to these decisions and the retroactive feedback that we have provided has largely been ignored. This top-down approach is not acceptable, and it's not working. We need joint decision-making and proactive communication. Second, the U of T's plans for reopening are based on incomplete and outdated science. They are premised on the idea that the virus spreads primarily via contact and close-range droplet transmission, and they ignore mounting evidence that the virus is also spread via airborne transmission and other pathways. Similarly, the U of T's plans do not account for symptomless transmission, that is, pre-symptomatic and asymptomatic transmission by folks who are not yet or never will be suffering from symptoms of the virus, and so are unknowingly going about their lives and affecting others. Third, U of T's case-by-case approach to the implementation of these plans creates or entrenches a number of equity issues. For example, among academic workers, teaching assistants who are not only working to make ends meet, but also to pay rising tuition fees while facing the fact that the pandemic has disrupted most of our programs so much that we are looking at another year in our programs before we graduate, TAs are also being asked to take on in-person work and the disproportionate risk that will accompany it. We now have more than 6,500 signatures on this petition. And thanks to this outpouring of community support, we have seen some movement from U of T. The university has developed a new mask wearing policy and guideline. Also, its largest faculty has allowed faculty and other kinds of instructors to take their in-person classes online. However, our core concerns remain. Universities still won't give teaching assistants and others the choice to take their work online. Instead, this choice lies with departments and even individual instructors who are supervising TAs. Also, the new mask wearing policy introduces new problems. For example, how will the policy be enforced equitably and safely? We know that when the university offloads the collective decisions to individuals, this is neither ethical nor fair. Our individual instructors, public health experts informed on the short-term and long-term risks associated with contracting COVID-19. Our individual instructors are responsible for the occupational health and safety of the TAs they work with. Should caretakers, library workers, and admin staff have to shoulder increased risk so that an environmental science or history class can move forward in person for pedagogical reasons? How does the university intend to justify the second lockdown to incoming students who want to return to in-person learning? Who does the university intend to blame for the second wave of infections that is surely coming if this reopening unfolds as planned? We continue to have to ask these questions and more of U of T. Please drop your questions in the Q&A field at the bottom of your screen. And now, without further ado, I will pass things over to Terezia Zoric, the U of T Faculty Association President.
Thanks so much for that warm introduction, Amy. I'm going to begin with an overview of our panel process, as well as a brief introduction to each of our expert panelists. To begin with, each of our first three panelists will be given a maximum of 6 minutes to speak. Following these initial presentations, we will have a facilitated discussion of about 15 or 20 minutes, which will be followed by a few brief additional comments from members of the Campus Coalition. By that point, we will have gathered your questions, which you will have put in the Q&A box, and there will be a second facilitated round of panel interaction. Our fourth and final panelist will speak at about 6:30, actually a little bit before, after which we hope to have opportunity for closing remarks from all the panelists and the president of the Steelworkers Local 1998. So without much further ado, let me proceed to introduce our panel. And I'll introduce everyone before I invite Ashleigh, our first speaker, to speak. Ashleigh Tuite is an epidemiologist and modeler who studies how we live our lives during this pandemic. Our second panelist is James Scott, who is a U of T leader in occupational health. He specializes in bioaerosols and has been doing mask efficacy testing and has just finished contributing to the development of health and safety standards for the CSA. Our third panelist is Arjumand Siddiqi, a Canada Research Chair in Population Health and Equity, and an expert on the social equity implications of diseases and pandemics. And our fourth and final panelist will be Dr. David Fisman, who is a national authority on the study of emerging infectious diseases such as COVID, and is the new leader of the new U of T School of Public Health Center for Pandemic Readiness. David is highly engaged with the most up-to-date international research on the spread of the virus. So let's begin opening the panel. For each speaker, I will pose questions to the panelist, who, as I said, will have 6 minutes to respond. At the 5-minute mark, I'll give an oral warning that time is nearly up. So let's begin with Ashleigh. And the three questions we're asking Ashleigh to address are the following. How, in a nutshell, is COVID transmitted? Why are universities risky places for COVID? And what is unique about universities and university in-person teaching, which produces risk? Ashleigh?
Hi, thank you so much for having me. So I am going to try and rapidly discuss the science of COVID. And I know that there's a lot of information out there, and our knowledge has really changed since January when COVID first emerged. And I think the biggest thing that we need to know, and I just want to make sure everybody is on the same page. I know some people have been following this very closely, other people's less so. So the main way that COVID spreads is by an infected person sending out small droplets that mostly travel small distances, but we're learning can sometimes travel farther. And James Scott, who's the next panelist, is going to talk more about this and what this means for us in terms of a safe reopening and a safe return to the university campus. But the one thing that really has changed is that early on, there was a pretty big focus on virus spreading by touching contaminated surfaces. But we know now that that virus on surfaces probably aren't the major way that infection is spread. You know, having said that, cleaning surfaces and making sure that we wash our hands is still important, but it's not the driving way that it's spread. It's droplets and basically breathing out virus and other people inhaling it via droplets or aerosols is really the major route of transmission. Given what we know about how it transmits, we also have a much better understanding of what types of settings increase the risk that somebody who is infected will pass the virus on to others. And I think a really nice way to think about this is what we call the 3 C's. And I'm going to show you on the slide that I'm going to actually show you 4 C's. So those 3 C's refer to closed spaces, crowded spaces, and close contact situations. And the 4th C that I've added here is continuous. So being indoors is riskier than being outdoors, particularly in rooms that don't have good ventilation. If you have more airflow, the virus gets diluted more quickly. And again, James Scott will talk about this more. This is his area of expertise. But again, indoors riskier than outdoors. The closer you are to somebody who is sick and the longer that you're in contact with them, the more likely you are to get infected. And this explains why infection is much more likely to spread among people who are living in the same household. Again, this idea that you're close together for longer periods of times. When people talk loudly, breathe heavily, sing, or shout, they'll expel more virus. And so that's why we've been really cautious about opening bars and gyms, because those sorts of activities are associated with higher risk of a person who's infected spreading to other people. So given all of this information that we now have, we know that, for example, wearing masks is really important because it reduces the amount of virus that you'll spread if you do happen to be infected. Having said that, they don't work perfectly, but they are an intervention that we use because we know that they can help. We've also learned about the importance of what we call super spreader events. And basically the idea behind a super spreader event is that most people who get infected with COVID don't infect a lot of other people. They'll infect 1 or 2, and sometimes no one at all. But there are a small number of people who will go on to infect a lot of people. And these super spreader events tend to be associated with the 3 C's. So people that are in indoor settings like weddings, funerals, meat processing plants, basically situations where you're indoor, crowded, close contact for long periods of times. And whether or not these super spreader events occur, again, it's going to depend on this confluence of factors. And my colleague David Fisman, who will speak later, refers to this as a series of unfortunate events. So if we can get rid of some of those C's, we can reduce the likelihood that we're going to see a super spreader event. And the one additional particular wrinkle with COVID-19 is that the best evidence that we have right now shows that an infected person is most infectious, and so most likely to infect other people a day or 2 before they start to feel sick and before they start to show symptoms. So in other words, you can have no symptoms, but still spread the virus to others. And by the time you show symptoms and try to restrict contacts with others, there's a high probability that if you are going to infect other people, you've already done that. And again, that's why having these measures in place and having them in place in contexts where we're not necessarily seeing a lot of sick people is really, really important. If I can go to the next slide. The one other piece I wanted to highlight is that we still don't really understand why some people get really sick and others don't. Some people will have no symptoms at all. Some people will have very mild symptoms, and others will have complications for months, and some will die. And some of the clearer risk factors for having severe illness are older age and having underlying medical conditions. I would like to note that although COVID deaths in young are rare, they do happen. And similarly, hospitalization is very common even amongst younger ages. So why is this relevant to U of T? We need to think about these, particularly the 3 C's, and think about how can we ensure that that confluence of factors doesn't exist on the campus. And I've been reading about a comparison to reopening university campuses that's similar to dropping a cruise ship into the center of a city. The idea is that, we saw early on in the pandemic that cruise ships were a really bad setting for COVID spread. The idea is that you have a congregate setting where disease could spread quite easily. And the concern is that on the university setting, you again have these congregate settings where you have a large number of people existing within a relatively contained space. The difference between a cruise ship and the campus is that the campus lives within a larger city and within a broader community. So what happens on campus doesn't stay on campus, it affects the broader community.
You have 1 minute, Ashleigh.
Okay. And so it's really important to remember that university campuses serve a number of different populations. So we have students, staff, faculty, and they are embedded in these larger communities. And communicable diseases are called communicable diseases because you communicate them to other people. They're different from other diseases because if you get infected, you can infect others. So the whole idea of the public health measures that we introduce is that we have to address this communicable nature. So when I ask you to wear a mask, it's not necessarily to protect yourself, although that may protect you. The idea is that you prevent the spread to other people. And so you are literally making life or death decisions for the people around you, including those who may be frailer than you. So even if you consider yourself, healthy and robust and unlikely to get sick, to have severe illness if you do get COVID, you wearing a mask will protect those who may not be so lucky. So I guess the key takeaways I'd like to sort of leave you with is that the more people there are in an enclosed space and the longer time that you spend there, the greater the risk there is of transmission. And the safety measures that we would consider appropriate for something like a trip to the supermarket is unlikely to be sufficient for the context of daily life on campus, just given the way that people mix and the intensity of these exposures, particularly in classrooms and in dormitories. And so we need to put measures in place to minimize the risk of transmission in campus, including measures like improved ventilation, reduced class sizes, and distancing within those settings, and keeping contacts to smaller groups so that if infection is introduced, that its spread is limited. And I'll end there. Thank you very much.
Thank you so much, Ashleigh. That's a very helpful place for us to begin, and we'll be interested in hearing more, and we'll give you a chance to elaborate on some of those points momentarily. James, I'd invite you to speak next. Thanks.
Excellent. So first of all, thanks to all of you for attending, and thank you to UTFA and the unions for organizing this important event. So as Terezia said, I'm a professor of public health, and one of the main areas of my research expertise for the past 20 years at the University of Toronto has been bioaerosol science. So I study how biological agents like this novel coronavirus travel around, and I'm particularly interested in the movement of these kinds of agents through air on very small airborne particles. I also teach in and lead the Dalla School of Public Health Division of Occupational and Environmental Health, which consists of 40 faculty members who are experts in occupational health and safety in the workplace and as well as the community. Our division delivers one of only 3 master's degree programs in Canada in occupational hygiene. And occupational hygiene is sort of the specialist field that trains the top tier of health and safety professionals. And we've been doing so for about the last 100 years. In fact, by this September, it should be exactly 100 years since we began this program in 1920. So my research and teaching expertise, I think, give me a unique perspective on real best practices in occupational health and safety as they relate to pathogens like this novel coronavirus. And it's really from this perspective that I've assessed the University of Toronto COVID-19 plan and found it to be seriously misguided and dangerously insufficient. So let me first of all explain a couple of areas where I think the plan really falls short. So first of all, the plan lacked consultation. In March, I met with the Dean of the Dalla School of Public Health, Adelstein Brown, and I expressed my concern that experts from our faculty really needed to be part of the university's planning process. In fact, the timing was ideal because our faculty at that moment had been commissioned by the Canadian Standards Association, CSA, to develop a return to work guideline document. And Dean Brown took my concern forward to the central administration. They provided us in return with a brief, very high-level document that, to my eye, looked like it had already been finalized. We provided a bit of feedback and offered to help, but our feedback was never integrated, and the central administration didn't contact us again. My second concern is one that Amy really highlighted at the beginning of this session, and that is that the plan that the university has produced is not science-based, fundamentally. COVID-19, as we know, is a bat virus, and initially in December and January, as the disease began to spread, very little was known about it, except that it was capable of being transmitted from person to person at very close range, as well as by contact with contaminated surfaces. But by March, credible scientific evidence was already starting to emerge that suggested that the disease could be transmitted through the air at longer distances than the medical community initially believed. This came as no surprise to us who work on bioaerosols, because we realized at the very beginning that this was mechanistically possible. But now there's general consensus that airborne transmission is far more important than initially thought. And this is extremely important because it highlights the potential for ventilation in heating, ventilation, and air conditioning systems, as well as other engineering controls to offer a point of intervention to limit the spread of this disease. It's deeply worrying to me and to my colleagues that the university has based its approach on the state of knowledge that we had in January, and it hasn't adjusted its approach based on the growing body of much more informative science that's emerged since. Many of the elements of the university's plan are striking in this regard, and I'll give you two examples. So the first example, the rapid closures that we experienced in March were very effective in stemming the COVID-19 pandemic locally, but they did set the stage for a number of challenges as we begin to reoccupy buildings that have had few or no occupants over the past few months. One of the main threats that's emerged is actually not related to COVID-19 at all, but rather to Legionella, the bacterium that causes Legionnaire's disease. This bacterium thrives in stagnant water, in underused building plumbing systems, including drinking fountains, and water that collects elsewhere in building mechanical ventilation systems. In our CSA guideline, we devoted a very large section to the discussion of how building water systems need to be maintained prior to reoccupancy to prevent outbreaks of this serious disease. And the university's plan says nothing on the subject. I'll note that the CBC a couple of days ago already reported some scattered suggestion of outbreaks in Montreal, and news outlets on the East Coast also have noted some potential for hospital outbreaks to be occurring there. And second, when planning their purchase of non-medical masks for students, staff, and faculty, and Ashleigh had alluded to this, the university ignored scientific evidence that was available as early as March on optimal mask construction. And that is that masks need to have a layer of cotton in order to be most effective. So rather than reaching out, the university ordered 250,000 cheap polyester masks from a distributor in Richmond Hill that specializes in offshore promotional apparel and branded pens. In contrast, universities like Ryerson, Western, and Queen's purchased Canadian manufactured cotton masks that will much more optimally protect their faculty, staff, and students. And I'll close with the observation that the university's plan really isn't a plan at all. The university's plan is a disorganized patchwork of 37 slide decks and spreadsheets that's in an internal web folder called Leadership Toolkit, whose opening paragraph notes in boldface that the resources contained in it should not be shared, and that access to the folder is limited to 4 employee groups: confidential, property manager, faculty, and library employees. Nobody else. Now, a real plan would have been developed in consultation with everyone, including our own experts. A real plan would have been based on science, and a real plan would have been a consolidated document that was available to all members of our communities, not just a few selected members. The members of our communities really deserve more from a university that makes such lofty claims about its commitment to excellence and inclusion. And I'll close with that.
Thank you so much, James, for that measured but extremely hard-hitting critique of U of T's plan. I'm particularly grateful to you for having answered my questions without me having remembered to ask them of you. But I'm looking forward to hearing the longer remarks that I know you have prepared. Just a reminder to the folks posing questions, there's a Q&A button at the bottom of your screen. We'll be collecting questions there, and it will be the focus of a second round of panel discussion. So please, if you have questions you'd like the panelists to respond to, kindly go to that Q&A button. Our next speaker is Arjumand Siddiqi. So I'll invite her to speak now for 6 minutes.
Thank you very much. So one of the biggest lessons we've learned from COVID so far is that despite everything we've heard from politicians, we really quite aren't in this all together. Working class people, especially Black and brown working class people, are much more at risk for getting exposed to COVID than are wealthy whites. And given the makeup of the University of Toronto community and who actually makes the university function, I was extremely disappointed that the reopening plans don't include even a nod to this literally vital issue. When all of this started, we didn't really have a lot of information about who was getting COVID beyond what neighborhood they lived in. And based on that, if you look at the number of cases of COVID in each neighborhood in Toronto, Black working class neighborhoods like Jane and Finch and Rexdale have had more than 500 reported cases of COVID each. Compare that to rich white neighborhoods like Yonge and Eglinton or the Beaches, which have had approximately 15 cases each, and that's sort of late July data. We now have a lot more direct information on people rather than just their neighborhoods, and the results are the same or arguably worse. So 83% of COVID cases in Toronto are happening in racialized people, even though only about half of the city comes from a racialized group. Over half of COVID cases in Toronto are happening in people from low-income households, compared to about a quarter of Toronto households being below the low-income cutoff, for example. And the income statistics aren't separate from the race statistics. They're the same people. So in other words, what this means is that COVID cases are, again, happening primarily in people who are both racialized and working class. So we haven't been able to do a lot of formal research to understand what exactly is going on, but the writing is pretty much on the wall, and I'm sure it's not news to many of you. These numbers happen because working class Black and brown people have been forced to go to work because they do the kinds of jobs that make our society run every hour of every day. They are our grocery store clerks, our cafeteria workers, they clean our buildings, they make our deliveries. Meanwhile, the jobs done mostly by rich whites have allowed them to stay at home and protect themselves. They are our doctors, our professors, our presidents and vice presidents of organizations. Sometimes there are families with multiple generations of so-called essential service workers who are living in the same household. Because Toronto is so segregated and so expensive, many people doing these kinds of jobs live in the same areas, which means that the people that are likely to get infected are also Black and brown and working class, getting infected often from each other as well. So these areas are also often on the outskirts of the city, where you have to take multiple buses and so on to get to work and get back home. And it's very difficult and very different to come to work from Jane and Finch than it is from Rosedale. And this brings me to the University of Toronto reopening plans. I read over the documents that have been released by the administration and am, again, very disappointed that this fundamental issue has not been at all addressed, despite the fact that we have Black and brown working class students, even though they are vastly underrepresented at the university. Black and brown faculty and higher wage earning staff who have working class parents and grandparents who they look after. And especially the bulk of the people running the University of Toronto, the staff are no different than the people running broader society. This is, again, predominantly Black and brown working class people. They are our cafeteria workers. They maintain our U of T buildings. They make our deliveries. And they will undoubtedly be the most exposed because they spend the longest hours at the universities, because at the university they cannot confine themselves to small areas and so on. So if you look at the documents that the university put out about reopening, there's actually a section in one of the documents on equity and diversity, but it really comes off as lip service because it addresses a lot of potential issues that may arise in the future. These are real issues like targeting groups because of racist ideas around COVID and how policies will get sort of policed and so on. But it doesn't say a word about
the 1 minute warning. Just 1 minute. Thanks.
But it doesn't say a word about the equity issue we already know we have. And that is this issue that our community is not going to be equally hit by COVID, but disproportionately hit across groups. And we know this from our data and our knowledge of who makes up the University of Toronto community. We know who would have to most likely expose themselves to risk when we open up, just as they've exposed themselves to risk as the city is opened up. And so to me, it's impossible to think about safe reopening plans without acknowledging that reopening has very different implications for different people in the University of Toronto community, and we cannot pretend otherwise. The trade-off is that by giving students this in-person rather than online university experience, we are asking many of the people who would make that experience possible, as well as many of those students themselves, to risk their lives. And it just seems like an unconscionable trade-off. I'll leave it there.
Thank you so very much for that powerful opening statement. I'm looking forward to hearing more from you and from the other panelists as well. It's my pleasure now to introduce Preethy Sivakumar, who is a CUPE national representative working with CUPE Locals at U of T. She'll be facilitating this first round of the panel discussion with follow-up questions and also a subsequent round of questions arising from where you put them in the Q&A, but I'll let Preethy remind you to do that. So thank you very much to my panelists, our panelists, for the opening statements. Those were superb. Thanks so much.
Thank you, Teresa. And thank you to the panelists for those very informative opening presentations. I'm sure that many of you have follow-up questions. I can see that there are some questions coming in. Please make sure that you're typing them into the Q&A box. You'll find it at the bottom of your screen. That way, members of our team can actually see your questions. So for now, we have some initial follow-up questions for the panelists. The first question is for Ashleigh. Ashleigh, you mentioned that people of older ages and with underlying conditions are more at risk, but that younger people can also get fatally sick with COVID and have been hospitalized. So could you tell us why someone who's, say, 25 years old, why should they care about the risks of reopening in person? And what does the most recent research tell us about that?
Sorry about that. Yeah, so I mean, I think there are a couple of things to note. The first is, you know, the risks of death and severe outcomes are lower in young people, but they're not nothing. And I think a really important thing that we have to remember is that before January, SARS-CoV-2 and COVID-19 didn't really exist in our population. So we're still learning about it. And I think one area that we're really sort of uncertain right now relates to the longer term consequences of infection. So what we do know is that people who have been infected, and this is younger people, who were previously healthy, didn't have underlying medical conditions, who experience what would be considered a mild or moderate infection, so not necessarily even going to the hospital, just having mild symptoms, are reporting lingering effects associated with their COVID infection. And they have a name. They're called the COVID long haulers. And the sorts of effects that they're reporting are things like lung disease, heart problems, as well as mental health problems. And I would say, at this point, we don't know enough to say that, even if you get COVID and you recover, that's it. I think we need to be really cautious about being dismissive about having a COVID infection particularly amongst younger people or people who may consider themselves to be invulnerable. And again, just because you fall into that lower risk group doesn't mean that you're not going to experience risk. I think there's actually data that's starting to emerge in the United States from the CDC, where they have had high enough attack rates in the population where they can start actually measuring these longer term effects. And the data that I saw was suggesting that amongst people aged less than 30 years of age, about 20% were reporting prolonged signs of illness. And the other part of this is the fact that we are humans and we are social and we have people that we care about and people that we love. And so even if you do get a COVID infection and you are fine, you still have to acknowledge the fact that you can spread that infection to other people. You can bring that into your homes, you can bring that into your community, and you can introduce that to loved ones, whether they be friends or family. And those people may not, if you recover, they may not be so lucky. And so I think, again, the fact that this is a communicable disease and it is communicable, that aspect of it is something that's really, really important to consider, because as a society, what happens to one person affects other people. And so I would say, beyond caring about your own health, you need to think about what the repercussions are of introducing infection into your broader network of people that you care about.
Thank you so much, Ashleigh. That's perfect. That kind of eye-opening information needs to be more out there. My next question is for James. Can you tell us what your specific recommendations have been to U of T around what needs to be in place?
Sure, I can try. We haven't really had much of an opportunity to provide any information back to the university. As I said, initially in March, shortly after the university sent out a letter that described some of the initial ideas around their response, I immediately had a conversation with my dean, and I said, listen, we're actually doing this, not for the university, but we're doing this for the CSA. We've been consulted to other groups that are looking at putting together these back to work plans. We should really be involved with the university's planning process. And when we extended that offer, as I said, the university came back and gave us what was really a very high level document. It was an assessment tool draft that really looked at two things fundamentally. It was a decision tool for chief administrative officers to determine where they needed to stick signs in buildings and decals on floors, first, and secondly, how they could decide who should work from home. And that was it. And we provided a bit of feedback, mainly just to say it needs more. And that was it. And it disappeared into the void, and we didn't really hear from them again. And, at a certain point, a number of us in the School of Public Health got concerned, and 19 of us were signatories to a letter that got sent to President Gertler. And I guess it was June, towards the end of June, And we expressed our concerns not only about our lack of involvement in the planning process, but on some other issues as well. 10 days later, we received a response from members of the administration that thanked us for our commitment to assisting cities and the province and Canada and worldwide in COVID, but nothing about participating with the university. And that was that. That was it. That was the end of the story. So, I feel so strongly about this, and a number of us do, that that despite my 20-year-long career with the university, having known that UTFA exists, and I'm grateful that they negotiate collectively on my behalf, I haven't really had much involvement with them. This is too important to let that slip. So then I stepped up to the plate with UTFA and said, listen, I really am willing to help you guys move this forward with the university, because something has to be done. This is too important.
Thank you, James. Clearly, the status quo health and safety plan from the university has way too many gaps. I think we are still getting a lot of questions. So this is a reminder to type in your questions into the Q&A box so that we can ask our panelists. My next question is for Arjumand. You've mentioned that there is disproportionate COVID impact on marginalized communities, particularly working class and racialized folks. Can you tell us what your advice is for an equitable reopening plan?
I'm not sure I have advice for a reopening plan per se, but I do think that the principle needs to be that those folks who are the most vulnerable need to be front of mind as policies are unfolded and reopening strategies and reopening timing is sort of considered. So in other words, I don't think we can have a plan in which what we're doing is considering what would happen on average and forsaking the fact that the bulk of what happens doesn't happen to the average University of Toronto community member, but is concentrated in, as you said, Black and brown people, in working class people, and I think really more to the point, the intersection of that, which is working class Black and brown people. And so I think what I would offer is not a plan per se, but a principle which says that until those folks are safe, that we cannot proceed with life as usual. And in fact, it's not just that they would be unsafe amongst all community members, it's that they would have to make themselves unsafe in order for the rest of us to operate. So you're not only exposing them to risk differentially, you're doing that because you're essentially forsaking them for the rest of the community, and that's what's completely unacceptable.
Thank you. There's still time to submit more questions in the Q&A box. And before we get into more question and answers, I'm going to hand it back to Terezia for a few minutes.
Thanks very much, Preethy. At this point, we're going to hear from some additional voices people who are members of the Campus Coalition with whom we've been working. First up, we have Kyle Shaw-Mueller, who is Vice Chair Unit 1 of CUPE 3902, the unit that represents teaching assistants. Kyle is also a doctoral student in anthropology. Go ahead, and he'll be speaking for up to 2 minutes. Thanks, Kyle.
All right, good evening, everyone. I'm glad so many people have showed up. This is really heartening. So U of T is claiming that teaching assistants have the choice to work remotely if they want, but this choice actually isn't universally available. Fortunately, some campuses, faculties, and departments have made the switch to remote delivery only, but many others continue to embrace the dual delivery model. If you're in a department where the only work that you are qualified for is in person, either because you're a new student or are getting last pick for other reasons, which can include reprisals for union activism, unsatisfactory academic progress, or even discrimination, then you have to make a decision between accepting unsafe work and no work. Obviously, this is not a real choice at all. For example, I've heard from many TAs who need to take up work, but are worried about endangering immunocompromised family members. The university tells us that, assuming they get a job, members can go through the accommodation request process. But there are many problems with that, such a case-by-case model. Mainly that it depends on workers' knowledge of and trust in the accommodation process. Thus, many will avoid taking up apparently dangerous work because they simply did not know they could apply for accommodations, but also because the process far from guarantees safety, especially if the concern is about friends or family who risk exposure from a TA forced to work in person. The best guarantee of community safety is no in-person contact wherever possible. And TAs should have a right to refuse unsafe in-person work the same way instructors do. They should not merely be consulted on the matter before administrators or instructors make the decision for them. That's why I'm very glad to see so much of us here today who believe all workers and students should have a choice.
Thanks so much. Our next speaker is Alan James, President of CUPE 3261. Alan?
Thank you, Teresa. I'm Alan James, and I'm president of CUPE 3261. Our members provide a range of services such as custodial cleaning, food services, grounds, parking, and many more. Our members' work is important to support excellent teaching and research at the U of T, and we are proud to do this work. We want to be able to do it safely. It has been a hard time for our local. We represent some of our lower paid workers on campus, and many of them are laid off. Most of our contract workers have also lost work and do not have benefit or paid sick leave. On top of all of this, last week, the university gave some of our cleaning work to private contractors. High anxiety and uncertainty, especially during COVID. This is an irresponsible decision that endangers our community safety. Time and time again, research has shown that private cleaning companies cut corners when it comes to safety and pay poverty wages. There are cases where private cleaning results in poor infection control and has even led to outbreaks. We want all the members of our university community to be safe. That means having this work done in-house, staff who know our buildings and the people who work there, having decent work, having a union. When workers have decent work and is part of a union, it means we can assert our rights to safety, equipment, and proper cleaning standards. We are only as safe as our weakest link. Our local has launched a campaign and we are asking for your support. Please sign our petition asking U of T to bring cleaning in-house. You can find more at www.3261.cupe.ca. Thank you.
Thanks very much, Alan. Our third and final additional voice will be Mark Austin, who is the Health and Safety Representative at USW Local 1998. Mark?
Thank you, Teresa, and good evening, everybody. I'm Mark Austin, USW Local 1998 Health and Safety Officer and Chief Steward at the Victoria University Unit. We believe that it's essential that the Union, Faculty Association, JHSCs, and all workers' right to participate in the ongoing safe return to work planning is respected, and best practices for protecting the safety and health of our campus community are followed as we draw closer to the reopening of our campuses. Union and faculty members know their respective workplaces best and have the knowledge to provide meaningful input into ensuring a safe return to campus, and their voices should be adequately heard. As it stands now, All faculties and departments follow the university's general workplace guideline, and it is left to the CAO of the respective faculty or department to develop a safe return to work plan and submit it to environmental health and safety for approval. This would be the opportune time for input from workers. But again, the plan is submitted to environmental health and safety without the input of workers that know the workplace best. While the role of the Joint Health and Safety Committee is critical, the conversations and decisions related to the safe return to work plan need to be made centrally with union and up for leadership at the table. Several requests have been made for one table so there can be an informed conversation with all parties. The U of T administration has refused this offer and continues to opt for a fragmented approach to dialogue and meet with each union body and the faculty association individually. All of the unions and the faculty association have serious concerns around the level of safety contained within the plan, and we're all frustrated by the response by the U of T administration. We believe a safe central plan needs to be developed with meaningful input centrally by the unions and the faculty association in regards to the plan, which includes, but is not limited to, an ongoing central forum for information sharing, monitoring and input, in addition to training for our individual health and safety committee representatives on their role related to the health and safety in their separate workplaces. There has been substantial efforts made by the university to ensure the JHSCs are compliant with the Occupational Health and Safety Act in terms of their day-to-day meetings and inspections, but minimal efforts at best to ensure best practices are followed and JHSC members are included and knowledgeable around their rights as members of the committee, especially during an unprecedented time such as this COVID pandemic. Thank you.
Thanks very much, Mark. So now we're ready for the moment many of you have been waiting for, where your questions will be posed to the panelists. So I'd invite Preethy to facilitate this next segment of our presentation.
Thank you, Teresa, and thanks also to Kyle, Alan, and Mark for your remarks. It's been great getting a lot of questions, some great questions, and I'll start us with a question for Ashleigh. This is a question about how much viral load there is from an asymptomatic person compared to symptomatic.
Hi, sorry. Yeah, so again, as with all things COVID related, I'm always hesitant to say anything with certainty, but at this point we do have emerging data that suggests that the viral loads are comparable. So there are, I guess, two aspects to the question. The one is the pre-symptomatic period. So anybody who is infected experiences a period where they shed virus before they develop symptoms. And then there's a subset of people who never develop symptoms. And the best estimate is around 20% of people would fall into that group. And it seems to be age dependent. So it's far more likely for a young person, particularly a child, to not have symptoms relative to someone who's older. But we do have some emerging data that indicates that the viral loads don't seem to differ between those two groups. So even if you have no symptoms at all over the course of your infection, you still appear to be able to shed that virus and infect other people.
Thank you, Ashleigh. I've got a lot more questions here, but just moving along. This next one is for James. James, you mentioned that you have not seen U of T, get back to you when you asked about participation and consultation in the plan. So my question is whether any information you've requested has been provided by U of T. And second part to that question is what your concerns are from an occupational health perspective about some of the gaps in their plan.
Sure. Well, let me try to start off with the first. So there's really only one item that I've actually requested from the administration, and it started with a letter that was sent out to the faculty by the administration on July 27th. And that was sent out by Kelly Hannah Moffat and Heather Boone. And in that letter, they stated, and I'll quote this, that all classrooms and office spaces have ventilation systems that meet or exceed public health guidelines. And stuff like that to me really stands out, because it seemed a little optimistic for my liking. And normally, when I think about ventilation, I like to point to very specific things, and this didn't. So I want a little bit more information. But the document pointed to one of the 37 documents that were in that leadership toolkit that I mentioned, the one behind the firewall. And the document that it linked to was specifically for campus building resources. And this reference turned out to be a one-page question and answer on ventilation that had a preface that reiterated that false narrative about COVID-19 not being spread through the air. And the Q&A was actually 3 questions, and it related to some of the issues that I've seen kind of coming up through the chat about MERV filters and things like that. And this document is not nearly as optimistic as that very sweeping statement that was included in that letter that came from the central administration. But it still didn't specifically address what particular kind of testing and validation had been done in any of the systems, the ventilation systems in these campus buildings that were referred to in the letter. So UTFA has twice met with the administration and requested specific information on which buildings were assessed, by what methods, and against what criteria. But the university has so far failed to give us any information on that. And that's really the information that we need in order to be able to understand, well, first of all, if the claim is correct, if all of the spaces that the university has referred to that will be teaching spaces and research spaces do meet at least the minimum standards for ventilation, which we know increasingly are important as evidence emerges that this disease is transmitted through the air. Without that kind of information, it becomes very, very difficult to make any sense of what the level of risk is in terms of longer distance transmission in some of these spaces. We know that campus buildings are not a single thing. Campus buildings are everything from century-old houses or more all the way to glass and steel towers. They have very different ventilation systems. They have very different needs around occupancy. And so I understand that this is a complex task, but there is a group at the university that manages that complex task. And I know they have these records. We have folks in the faculty who have a great deal of expertise in evaluating these kinds of things. They know an awful lot about this. They write the guidance documents for organizations like Ashleigh. So we can evaluate this, but we can't do it if we don't have the documents. So that's sort of to the first question. And in a way, that's kind of my point to the second question as well. It becomes very difficult for those of us who know an awful lot about this area in occupational and environmental health to give meaningful, practical advice to the university if they fail to give us the information that they have that informs the information that we would give them. You know, it's a cyclical problem. So there are some low-hanging fruit kinds of pieces of advice that I could give the the university, particularly around things like Legionella, around things like the hierarchy of controls. They continually bring up the hierarchy of controls as informing their plan. But my read of their plan is that it doesn't really abide the hierarchy of controls, which is a framework tool that we use to evaluate risk and inform interventions. Maybe we'll get into that discussion a little bit later. But short of the university cooperating with us, the short story is there really isn't an awful lot that we can do.
Thank you, James. The next question is for Arjumand. It's a follow-up question to some of the points you made earlier. If everything moves online and that means there's less workers on campus, that could also have an impact in how much physical work there is on campus. But when Alan James spoke earlier, he also mentioned that it's important that workers on campus have safe work. So can you comment on how vulnerable it makes workers who are on campus if there's a sudden increase in people returning without adequate attention to these gaps in the plan that you've all been pointing out?
It's a great question. I'm not going to be able to answer how vulnerable it gets people, it makes people, but I can tell you that if there is vulnerability, it falls on them. So I think part of the message is that we have to accept that when there is risk for COVID, when we talk about risk for COVID, that underneath that is unequal risk. And so all of this stuff that we're talking about that can affect people, from whether it's ventilation, lack of distancing, et cetera, it is going to disproportionately fall on the people who are working to keep the university going. And as I mentioned, the reason that that's the case is because they are going to be there the most. They are going to be all over the university. They are going to be interacting with people by definition of their job, interacting with many more people by definition of their job, and so on. So I think the basic issue is that, again, any reopening plan, any issue is magnified and disproportionately falls on people who are the very people who are running the university.
Thank you so much. There's a lot of questions about classrooms, and perhaps I'll ask Ashleigh and James if you'd like to also jump in after Ashleigh on this question. This is about what the maximum amount or what the limits are for how much time students could spend in the classroom, whether they are masked or unmasked, and how many students there can be in a room, and how much time is required between classes to properly air out a room. And perhaps following up on that, James, you can tell us whether you think U of T's plan pays attention to these kinds of limits and whether they've thought that through.
Sure, I can attempt to answer that. The short answer is I don't think that there's a simple solution or a simple answer to that. The reality is that you want as much space between people as you can. Masks are mainly beneficial as source control. So if you are infected, or the non-medical masks at least, if you are infected, you're going to prevent spreading infection to others or reduce the risk that you spread infection to others if you're wearing it. In a classroom setting, it's really going to depend on how the classroom is set up and the sort of style of the classroom. And if you're thinking about a typical lecture style room where most people are sitting there and not really talking a lot, and you really have a professor or an instructor standing at the front of the classroom speaking, that professor is probably going to be the person who is generating the most droplets or aerosols, whereas, and again, sort of shouting and speaking is associated with higher risk of viral transmission. So in terms of time and space, I think the big factor is the ventilation. I mean, ideally, if you're in a room where you have airflow and where you have that under control, and you have the source control in terms of masks, and you have people spaced far enough apart, and you don't have a lot of shouting happening, which, again, in a classroom is not that likely, aside from if somebody is speaking loudly to try to project, particularly because they're wearing a mask. I don't think there's a fixed answer to that. I really think that thinking about those 3 C's, and the 4th C, which is continuous, again, the amount of minimizing the amount of time is ideal just because of that sort of confluence of factors, the fact that you're indoors, the fact that you're potentially talking a lot. But again, I would say probably the one thing that would change our comfort with that sort of situation would be the ventilation. And I think airplanes are a good example of a situation where you do have a lot of people sitting closely together for long periods of time where they have really good ventilation. And so transmission on airplanes hasn't really been a thing as much as you might expect it to be, given the sort of system that people are traveling in. I turn it over to James because I think he probably has more to say about the ventilation side of things, which I think is the important piece.
Thank you so much, Ashleigh. And James, when you're getting into the question, you did mention the hierarchy of controls earlier. So if you could also connect it back to that and explain that. I think we have a slide also.
Maybe, I don't know if I can. This may not be the place for that slide. But sir, first I'll echo the points that Ashleigh made about ventilation and close quarters. Ventilation absolutely is important. The ventilation systems in classrooms are just a spaghetti mess of differences across campus. So some work reasonably well, others, even when they're working the best they can, don't work very well. And just the configuration of where air is supplied and where air exhausts can be really, really important in those kinds of environments. So I think it's really difficult to simply look at a floor plan of a classroom and draw circles that are 4-meter diameter circles and say, well, we can plant students in these seats and everything's going to be fine. That doesn't make any sense to me at all. And I'd even go a step further, and there's a logistical piece here that tells me that the people who came up with these ideas in the first place have either done no classroom teaching or very little classroom teaching, because there's the logistics of getting students into and out of those classrooms. I've done enough undergraduate teaching to know that there's usually a lineup of students in the hall. When you get there, you open the door, they go into the classroom, they find their way, they do that kind of thing. And then they move out. How does that happen? We have no idea how that happens because that's not part of the guideline. Furthermore, what happens when, say, in undergraduate courses, and this has happened to me a number of times because I've taught upper year biology courses where every student wants to get into medical school. And if you tell those students that only 20% of them can come to the classroom, I guarantee that 50% or more will come to the classroom because they want to get into medical school. What do we do with that? You know, this is something that's not planned at all. So I see the tape that's put over top of these seats based on measurements getting ripped off and students simply sitting in them anyway. Like, this is not a plan that's anchored in any kind of realism or realistic knowledge of how these things actually function. Okay, that's the end of the rant. Maybe we'll come back to hierarchy of controls later.
Sounds good, thank you. There are a lot of questions that we've received around transit and commuting in particular. And maybe I'll just open this up and each of you, Ashleigh, James, and Arjumand, if you'd like to comment on this perhaps briefly. Do you feel that U of T's plan adequately takes that into account? All of the commuting that people do to get in and out of U of T and its physical location of its campuses?
I would say no, and that's something that I think about a lot, and that's probably my biggest concern. You know, the only thing that I've really seen about transit is that if somebody travels by transit, they're meant to change their face covering when they get onto campus. I think, there are a couple of reasons why transit is concerning. The first is that, it's a potential, again, closed space with lots of people. So it does, potentially represent a source of infection if we do have people riding on transit who are infected. And the other piece to that is we want to maintain our transit, and we want people who need to travel by transit to be able to travel by transit. And so if you have a lot of people moving around for reasons that can be avoided. So, if you can avoid having people come to campus and have them learn online, that reduces the burden so that transit remains open and accessible and, can be cleaned and, can sort of be available to people who need it. And so I think, again, this idea of the campus being embedded within a broader community, I think the transit is a really good example of how that works. So again, you have the campus, which is not sealed off from the rest of our city. And, people traveling create, a burden on the transit system, but they also provide links between what's happening on campus and what's happening in the city. And so I think that sort of back and forth and that connectedness is something that we need to think about. And, think about, if we reach a point where we're starting to talk about lockdowns again, or sort of dialing things up in terms of having more interventions in place, what happens if we start saying, we really want to restrict transit to those who need it and rely on it. So yeah, it's something that I haven't really seen addressed aside from changing your mask when you get to campus, and I'd like to see that addressed more fully.
Thank you, Ashleigh. And James and Arjumand, I'd like to invite you to also chime in on this if you'd like.
Yeah, I can't add much, except to say that I've gone through those 37 documents behind the firewall, and I only recall transit being mentioned in one place, and it was only 1 or 2 sentences.
I think in general, it's part of a broader issue, which is not recognizing the people who are making the university run and what their lives consist of, what their context is, and what their risks are. I think conversely, even if you didn't, even if the plan took some of these factors into account and didn't open, there's contextual issues around employment and so on, and security of income that they would have to address. And that's a tangent in a way, but I guess I wanted to get in there that I think there's a big issue of not recognizing what it actually takes to make the school run, and who does that work, and what it takes for them. And I think I mentioned this in my opening comments. It's very different to take a car or a subway from Rosedale than it is to travel out from Jane and Finch. And I just don't think you can make decisions based on the people who are coming from downtown or Rosedale, et cetera.
Thank you so much. We've had a lot of wonderful questions, but unfortunately we don't have time to get into all of them today. But this is not the last you're hearing from us, and we are collecting all of your questions, and we will have a chance to get back to you on some of them, some of the questions particularly around how to deal with an unsafe work situation, or how to, as a student, deal with being put in an unsafe situation. We are going to follow up with information about that. And for now, I'm going to thank you for your questions and thank our panelists for answers, and hand it back to Terezia.
But please don't think that the session is over. We're actually ready to introduce our 4th panelist, or reintroduce him. If you missed our introduction or came in late, our final panelist is Dr. David Fisman, who is a national authority on the study of emerging infectious diseases such as COVID, and is the new leader of the U of T School of Public Health, the Dalla School of Public Health, Center for Pandemic Readiness. And we've invited David because he's so highly engaged with the most up-to-date international research on the spread of the virus. And so I'll ask him, as I did other panelists, to kindly make a 6-minute opening statement, and I'll remind him when he has 1 minute left. David has been truly a public intellectual on this issue, and we're most honored to have him join us. Thanks, David.
Oh, it's a pleasure. And thanks to you, and thanks to CUPE, and thanks to UTFA, and thanks to the student allies for coming. I don't actually think I have 6 minutes to say here, because I have very little to add to my excellent colleagues. I mean, between Ashleigh, Arjumand, and James.
So sorry, David. With you, I actually have to read the questions I'm going to pose. The others,
okay.
You didn't need it. Right. This is entirely my fault. My apologies.
Okay.
So if you don't have 6 minutes, then you're going to get to each of our 3 questions, I hope. Okay.
Sure.
Our first question for you, and there are 3. How do you rate U of T's plan overall? If you're feeling playful, maybe give them a letter grade. Second, in light of what you are hearing at the WHO and based on international research and your discussions with colleagues globally, what are your specific concerns about U of T opening? And then third, and I know this has been coming up in the chat, why is your expert opinion and those of your co-panelists at odds with some public health guidelines? So first, rating U of T's plan. Second, emerging research in the U of T opening, and then public health, please.
Well, I'm gonna give the school a weak D grade because they did get hand sanitizer dispensers, so that prevents the F. You know, I don't know what led the university to shut down in March when it did. There are rumors abroad about whether or not we had outbreaks on campus or in residences. Obviously, the university hasn't said anything about that. I don't know if that's true or not true. I do know that I share James's concerns that the reluctance to shut down in March when it was awfully clear where this was going. I know I went online with my teaching because I wasn't prepared to confer risk on my students, having them, a lot of my students commute down to the School of Public Health, and it just didn't make sense anymore for us to be, for them to be riding down on transit to spend time in a crowded room with me when we could do it online. So we went online pretty fast, I think a week or two before the university did. And part of that concern is I'm a very, very part-time physician, and I was actually doing infectious disease service at Toronto Western just in between teaching classes that week, and did not wish to expose my students to me. But I'll tell you, in terms of failing grade, there's just a lack of understanding of what this disease is. And you know this, you, I, James, Ashleigh, Arjumand, many of us have reached out to administration and said, you know, this is what this disease is, this is what it does. 50% of faculty are over the age of 50. We know that putting them in a classroom to teach students is sort of like, is potentially, if we have an outbreak on campus, the mortality of that is like sending a Marine to Vietnam. You know, 20% of them aren't coming back. And one of the silver linings of this disease is that mortality does take off sharply when you're old like I am, when you have your gray beard like I am. I'm 51. And I'm right at that inflection point where mortality starts taking off. Most of our students are at low risk of dying of this. But as Ashleigh points out, they make up a substantial proportion of infections. And so that, you know, they represent 10 or 15% of those hospitalized. But I think I respect this disease so much, partly because I have lived in both worlds over the last 6 months. I've been researching this largely with Ashleigh very intensely. I've been learning a lot. I've had my, all of my assumptions have been turned upside down. And I've also seen this at the, you know, at the tip of the spear in the ICU, where you're caring for these people who can't breathe anymore and who are on pressors, that's medicines to keep their blood pressure up, and who are going into organ failure and are dying. And just to circle back to Ashleigh's point, it's a communicable disease, right? It's a communicable disease. Communicability means that it doesn't stay in one person. If you get COVID, you give COVID, and you don't get to choose who you give it to. You don't get to choose that you're going to give it to a young person who's going to be okay. And indeed, in my experience in the hospital over the last 6 months, we've seen this repeatedly, this tragedy where, to riff on what Arjumand had said, often younger people in a household, often these are lower income households, people of color, doing essential work. A 30 or 40-year-old goes to work, gets COVID, brings it home, and it's the mom and the dad who get it, and one of those dies. We saw that repeatedly, where this hit families and killed a parent, and the other parent recovered. So imagine how that feels to be the kid who brought COVID home from your workplace, and one of your parents died, and the others survived. So I have tremendous respect for this. We've learned a ton over this summer about how this spreads. Clearly, airborne transmission and aerosols are important. that's kind of a paradigm shift that's happening right now in the infectious disease community. And there's some people who are kicking and screaming, but I think most folks who are current realize that we can't explain how this disease works without invoking aerosols. As Ashleigh said, it's a series of unfortunate events. Probably people with high viral load in mucus create aerosol in closed, close, and crowded spaces, exactly like a lecture theater. And that's how we get our super spreader events. So, you know, I've gone a little bit off the how do you say, off the ranch here, a little bit off leash. But let me just sort of circle this back. What's always struck me as absurd about U of T's response is if it's about pedagogy, how in the name of sanity are you offering identical courses in an online version and an in-person version for credit in the first autumn of a once-in-a-100-year pandemic? And you're saying we can't possibly dispense of that in-person teaching when you're already teaching the damn course online for the same credit. It's absolute madness. It creates risk for obviously for us as instructors. I'm lucky. I work in a faculty where our dean, Staney Brown, has already been mentioned. Staney has told us, you know, we do what's right and what's good for us and our students. And I think most of us are online, but there are a lot of places on campus where that's clearly not the place. That's not the situation at all. And I'm extremely concerned about that. I'm extremely concerned about people feeling coerced. I'm extremely concerned about people being pushed into situations that amplify risk. And I'm concerned that we already have 5,000 students apparently living on campus, according to administration, who have trotted that out as evidence that it's no biggie to have lots of students on campus. And now we're in for a surge to how many? Well, they won't say. Is it 10,000 students, 20,000 students, 40,000 students? How many students are going to be living on U of T campuses? I think Ashleigh was pitch perfect in terms of referring to it as dropping a cruise ship into the middle of a city. Thank God most of the students will be fine. If we have high enough attack rates, we'll lose a student or two. But those students' experience is also kind of made possible by the older people around them, whether they be staff or faculty. And I think if we're going to call ourselves a community, we have to behave like a community and value everyone. What I would also say in terms of light...
David, if I may, I'm certainly going to give you a couple of minutes to finish. Yeah. I wanted to give you a warning. Just something came up in the chat that you might want to integrate into the last piece of what you're saying. And that was that, yes, a number of students tested positive in March at University College and Rotman. So yes, we got confirmation about that. And if you're able to, as you conclude, I'm wondering if you could circle back to why U of T keeps referencing public health on the one hand, and also the people who know me know I want to use more colorful language, the disaster of university reopening to the south. I don't know if you can attend to both of those questions in the next minute or two.
You know, we're kind of in this funny catch-22 isn't the right phrase for it, but if you talk to Toronto Public Health, they make it clear that, you know, what happens on campus is more or less up to the folks on campus. The campus folks keep referring to Toronto Public Health guidance. The folks we've spoken to, I've had one interaction with them with you, Teresa, have clearly been uninterested in going above and beyond the very basic box ticking that might allow them to sort of kind of create the optics that they're doing something to protect people. I didn't get the impression that the folks we spoke to really gave a damn about safety. Clearly this is mostly about optics and some other things that I don't want to get into. But I think those of us who have a bit of a conscience on campus, who value our coworkers, who value our students, who value our institution, who value the city around us, for God's sake. I think it's on us to act in ways that are a bit more appropriate than what we're getting from central admin. And let's be clear here. There's light at the end of this tunnel. I would never have expected us to be at the point where we have phase 3 trials on extremely promising vaccines in in August of 2020 for a pathogen that emerged in January, or maybe a little bit earlier. I think there's someone online from Deputy Prime Minister Freeland's office, who's also our MP, and I'm going to make a shout out there. And I think there's also someone online from Jessica Bell's office, who's our magnificent MPP. And thank you for being here. I'm just going to single out Deputy Prime Minister Freeland's office, because Deputy Prime Minister Freeland helped push for Canada to get to the front of the queue to buy vaccine, and vaccine is coming, and it looks effective. So, you know, we're not talking about canceling campus forever. As I've been saying, we're talking about avoiding a predictable, avoidable mass death event in the first, you know, autumn of a once-in-a-century pandemic. And I think it's on U of T to you know, use the precautionary principle and use, you know, be up to date with the science. There are a lot of lives they're responsible for here. Staff, faculty, and students. And they need to do the right thing, and they have not to date. And as James says, they've been phenomenally shifty. I mean, how hard is it to provide the documentation on what's happening with HVAC? You know, it's just so disappointing. Anyway, I'll leave it at that.
No, it certainly is. And thank you so much for those remarks, David. We do have time now for a closing statement from each of the panelists. I'll circle around to you. We'll go back to where we started with Ashleigh and then James. I would ask people to keep these closing comments to about 2 minutes, just maybe to highlight anything. And David, if you think it's appropriate, once we make our way back to you, I'd remind you, I think a lot of people are watching American universities and wondering whether it is or isn't relevant to the Canadian experience. So I'll just plant that seed as a possibility of where you go. But I'd invite Ashleigh now for her closing comments.
Okay, thank you so much. I don't really know that I have anything to say beyond what's been said so far. I mean, I would just remind everybody that, you know, as David just said, you know, this is a once in a lifetime, hopefully, event. And, you know, we're learning as we go. And I think we really, in situations where we don't necessarily know what the right thing to do is, we want to err on the side of caution, and we want to, you know, use the precautionary principle and try to, you know, get through the next couple months. I think, you know, the way that we understand COVID right now is very, very different from our understanding of it in January. And, you know, I think probably by, you know, the spring, you know, whether or not we have a vaccine, I think, you know, our ability to treat people is going to be improved. And I think our ability to understand the particular circumstances that are higher risk and the particular situations that are highest risk are going to improve. And so I think, you know, as much as it's scary to sort of face this very uncertain future, you know, we can use science to guide us and to reach a point where we avoid infection, we avoid death, and you know, we eventually will return to a life that is maybe not the same as it was before COVID, but closer to it. But I think we have to acknowledge the fact that we are going to have to disrupt our lives a little bit right now, and really we should be using the science that we have available to guide how we proceed.
Thanks so much for that, Ashleigh, and thanks so much for your contributions today.
Yeah.
James,
Thank you.
Thanks.
So maybe now is a good time to ask Preethy to put up that slide describing the hierarchy of controls.
Oh, James,
Yes?
we deleted the slide, sadly. So I know, I'm so sorry.
Okay, well, I'm going to talk about the hierarchy of controls anyway, because I told you about occupational hygiene, and the program that we host is a master's program in occupational hygiene. And occupational hygiene is a professional science that deals with the anticipation, recognition, evaluation, control, and confirmation of protection from hazards at work that may result in injury, illness, or affect the well-being of workers, as well as the broader community. And in occupational hygiene, we have this paradigm that's sort of a leading paradigm of how to do exactly what I laid out. And this is a thing called the hierarchy of controls. And the hierarchy of controls is an upside down pyramid, and it's got 5 stages. I'm just going to pull it up here on my screen so that I make sure that I get it right. So it's an upside down pyramid, and it describes how we approach dealing with hazards. And at the sort of top, which is the broad base of the upside down pyramid, is elimination. And if we can eliminate an exposure, that's always the best way to deal with it. Below that is substitution. So if you're working in a factory and you're using some very hazardous paint, and you need to use paint for whatever your job is, and you can't eliminate it, substituting it with something that's less hazardous is the next best thing. So then going below that is what we call engineering controls. And engineering controls involves things like moving air. Ventilation is an engineering control. It's the thing that the dentist sticks in your mouth that sucks air so that it draws away the smoke plume from your mouth, so the dentist and the dental workers aren't exposed to it. Similarly, we have those kinds of things in factories. In this case, engineering controls is making sure that the HVAC systems in the classrooms, if people are going to be present, if they function. Below engineering controls is what's called administrative controls. Administrative controls is sticking signs on walls, decals on floors, and arrows to make sure that the pathway of movement is only in one direction, essentially those kinds of things. Those administrative controls are not nearly as ideal as engineering controls because they only work if people comply with them. And then at the very, very bottom of the pyramid is personal protective equipment. And if all else fails and you can't do any of the stuff above, then you stick a respirator on someone's face, or you put them in a garment that's impervious to whatever the hazard is, and then you send them in. And what the university is doing here is really only focusing on those bottom 2. They're focusing on administrative controls, signs and stuff that only work if people comply with them, and then sticking some crappy polyester mask on people's faces. That's what we've got. When in fact, we can use not necessarily elimination in this case because we want to teach people, but we can use substitution. We can teach them online. We can teach them remotely if we had the resources to do that and do it well. And failing that, we've got a variety of opportunities for engineering controls. Both of those opportunities that sit higher in the hierarchy of controls are things that we could avail ourselves of, but we're not.
That's so helpful, James. Thank you so much. And I hope you saw that we did get the chart up there. So belatedly, that is extremely helpful. And I also want to personally thank you for the excellent work you've done on UTFA's Health and Safety Committee and your courage with the administration. It is extremely helpful. Thank you. Arjumand, I invite you for your closing thoughts as well.
Thanks so much. I'll just say 2 brief things, inspired by many of the comments my co-panelists have made about the fact that James just said we can easily substitute. As Ashleigh and David have mentioned, this is a once in 100-year phenomenon, and what we're saying is let's keep safe during this period rather than sacrifice people. And in that context, I think what's important is that the stakes are, we are basically, the administration is basically saying, we would like to do something that we perceive will have a benefit either to students or to the university. And in order to do that, we're essentially putting all the burden of risk on people who are vulnerable. And this is just, it's an injustice. And I think that can't really be reconciled. And the second thing is that and I guess another way of putting that is that the benefits of going back will not accrue to the people that will make this happen. The people who will have to work the hardest to give us those benefits won't benefit from it at all. In fact, they'll be putting their lives at risk. The second piece of that is something that I mentioned earlier, which is that in the event that the university wisely does not open up, we also have to be mindful that we have to advocate for people to maintain their employment, maintain their wages, and not be forsaken in the event of closing the university as well. So in all cases, as per usual, the most vulnerable people are the people who are doing the hardest work and earning the lowest wages, and we need to do something about that. I'll leave it there.
Thanks so much for that, Arjumand. This isn't, the equity dimension of this isn't just a dimension. The whole piece of it is an equity issue. And I think you've done a superb job of laying that out for us. I really appreciate the excellent job you did. But additionally, as we go forward advocating in relation to this, the political, the issue of justice, social and political justice here will be a central part of the work that the coalition does. Thanks so much. And then our final panelist, David, would you care to weigh in for a final couple of minutes?
Oh, sure. I mean, I don't think I have a couple of minutes worth of stuff to say. I think it's important for folks to realize that there are many, many people in our community, staff, students, faculty, who are working very hard on disease control and working very hard coming up with great ideas about how we can get through this very weird and very challenging time. I actually want to take a moment and do a bit of a shout out to the student working group at the School of Public Health. If folks who haven't seen their dashboard, they have an online dashboard that for a while, the first few months of the pandemic, was the go-to information source for the state of COVID in Canada. And in fact, the Alberta Provincial dashboard was linking to the U of T student dashboard for their daily reports, which is kind of awesome. They also tended to be a day or two ahead of Public Health Ontario in terms of how current their information was. So many of us have worked very hard. Many of us, it's wonderful to, Teresa mentioned, I had the privilege of speaking to the WHO on August 4th, and it's magnificent to see, you're on a Zoom meeting and you're looking at who's attending, and there were 4 different colleagues from University of Toronto who showed up in the audience. I didn't realize they were doing stuff with WHO. A lot of us are working really hard. A lot of us are trying to push this forward. A lot of us are trying to help government make good decisions. And so it's very, very frustrating to be, I'll say patronized, belittled, and dismissed by basically a small group of administrators who respectfully, I don't think know what they're talking about when it comes to COVID. So, thank you, Teresa. Thank you, CUPE friends. Thank you, steelworkers. Thank you, student groups, grad student groups for, joining this fight. Thank you, our representatives, Jessica Bell and Christia Freeland, for, hearing our voices. And I don't have too much more to say. I think, courage, everyone. It's going to be a weird fall, but there's light at the end of the tunnel. The science is moving fast, and we're going to get through this, but we need to not do dumb stuff this fall. It's important for us to keep each other safe and to look out for each other. That's what a community is, and that's what a community really does, is we give a damn about each other and we help each other. So that's all I got.
Thank you so very much. Thank you, David, and thank you to all the panelists. We're coming to the closing now. It's my pleasure to invite Colleen Burke, the president of USW Local 1998, to make closing remarks.
Thanks very much, and I hope my sound is okay. Somebody text me if it's not. I've been having some problems with my sound today. So Teresa has thanked our panelists, so I will just reiterate, thank you again to all of our panelists. I also want to thank the union and faculty association reps who spoke. Teresa Zoric from the Faculty Association, Amy Conwell, Preethy Sivakumar, Kyle Shaw Mueller, and Alan James, all from CUPE. and Mark Austin from USW, my organization. I'd also like to thank Sheeta Lodia and Kathy Johnson from the Faculty Association, who did a huge amount of work behind the scenes coordinating this event and pulling it together. And I can't believe we're on time and the tech worked and it all went fabulously. So thank you very much. COVID has turned our world upside down and left us all, workers, students, and parents, with a great deal of anxiety about health and safety, and as Arjumand was just saying, about job security as well, and as Alan alluded to. And this is something personally I've been trying to really grapple with, is this need to square health and safety, which is absolutely paramount, also with job protection. And I was glad Arjumand raised that in her final comment about needing some kind of job protection for workers on campus, because it is the most vulnerable workers who are impacted by so much of this, and that includes our members and CUPE's members as well. This coalition of CUPE, USW, and UTFA came together because we all have the same interest in having the campus be as safe as it can be for workers and students. And as the world grapples with this new disease, and all the scientists on the call tonight, we want to ensure U of T's reopening plans are based on the latest scientific evidence. As Arjumand discussed, it's very common to hear right now that with COVID, we're all in this together. But the fact is that COVID has had a very different impact on women, racialized communities, precarious workers, and people living in poverty. We're all in the same hurricane, but we're not all in the same boat. And that's why bringing different groups together to work in coalition is really important. We need to listen to each other, understand each other's experiences, support each other, especially when we are in different circumstances. So tonight's event was organized by a coalition of faculty and staff on campus, but we are all also part of a bigger group called UTO, that's an ongoing organization. It stands for U of T Employee Associations and Unions, and that also encompasses several student unions and student organizations. So together with them, we are planning another online event, which will be more of a town hall where we can hear from a broader range of the U of T community. And we look forward to having all of you participate. We will continue, all of us, those of us who organize this, the speakers, and I think a lot of the people in the audience, will continue to advocate for U of T to develop the safest plan possible so that people can come back safely. So on that note, I want to thank everyone for attending our event. Thanks again to all the speakers, and stay safe and healthy. Thank you.